Hello, everyone. My name is Jenny, and I reviewed a randomized clinical trial of beetroot juice consumption on inflammatory markers and oxidative stress in patients with type 2 diabetes. Now, according to the CDC, about 38 million individuals in the US alone have been diagnosed with diabetes, and about 90 to 95% of those with type 2 diabetes. And some factors that initiate and drive this disease's progression um, include oxidative stress and chronic inflammation. Therefore, due to its prevalence, researchers are studying the effects of specific nutrients and their compounds to find varying ways to help provide better outcomes and quality of life for these patients by reducing oxidative stress and inflammation, which can ultimately lead to long-term disability and disrupt metabolic homeostasis. Some topics I'll be covering. So the purpose of the study was to determine whether a concentrated beetroot juice supplement would decrease inflammatory markers and oxidative stress in individuals with type 2 diabetes mellitus. Now, this study is relevant to food science and nutrition because it requires the extensive knowledge of and skills of researchers in food science to investigate the effects of functional food bioactive compounds that may have beneficial health effects, helping to treat and prevent chronic disease, and also help with assess a compound's bioavailability. And since dietary interventions have demonstrated the ability to provide such improvements in health, a study like this is crucial so that the experiments conducted and their results may be shared and reviewed by dietitians and those in nutrition and in medicine to help guide their patients on ways to manage diseases such as this through consumptions of foods and other dietary recommendations. This was a parallel group, randomized, controlled, open label clinical trial consisting of 52 individuals between the ages of 35 and 70 with a BMI of greater than 18.5, kind of the normal, who were clinically diagnosed with type 2 diabetes. Um, Participants were randomly assigned to two groups, the intervention, which consisted of the consumption of 12 milliliters of beetroot juice two times a day for 12 weeks, and or the control with no intervention. And the participants were also requested to consume their juice at the same time each day between kind of main meals. They were also advised to maintain their usual dietary intake and physical activity. And as far as the baseline assessments, those were the same for both groups with anthropometric measurements, biomarkers, blood samples obtained, questionnaires, and a 3-day food recall. And interviews were every 15 days to ensure adherence. Now, the main results. The derivatives of beetroot juice led to a reduction of inflammatory markers IL-6, TNF alpha, and NF-κB in serum concentrations of the intervention group, which is significant because those reductions can help reduce complications for type 2 diabetes. Now, it's interesting that only specific inflammatory markers showed a significant decrease. The HSCRP and MDA did not. There were also no significant changes in anthropometric measurements, physical activity, or nutritional data throughout the study from the baseline to the 12 weeks. And interestingly enough, to note the anti-inflammatory effects of betalains in the beetroot were comparable to several other phenolic compounds like lycopene and beta carotene, and even nonsteroidal anti-inflammatory drugs. Therefore, the researchers concluded that the administration of 24 milliliters of beetroot juice extract did decrease the inflammatory markers mentioned. And this specific study demonstrates the correlation between nutrition and food science by examining the compounds in the beetroot and using that scientific knowledge just to understand more effective strategies for bioaccessibility of the food and how it impacts inflammatory markers. And this is relevant for the food industry as well, as they will have a better understanding of consumer demands and also products that would be beneficial to consumers' health, which would ultimately um, allow for a profit for them. The connection to this course, this study included statistical analyses of data, which utilized independent t-tests with two-sided p-values and an ANCOVA to eliminate confounding factors. Additionally, the researchers conducted extensive tests to analyze the properties and composition of the beetroot and kind of used equipment that we've kind of discussed, such as a spectrophotometer um, and other various tools. And then just really understanding the impact of plants and their compounds and how they may have health benefits. And again, the bioavailability of each of those. Some of the strengths were the extensive baseline assessments, which included just the anthropometric measurements, the questionnaires, the 3-day food recall, the blood samples, and the interviews by phone. Um, the limitations included a small sample size. In the end, the control only had 22 participants, and the intervention group only 23. So a larger number of participants could draw more accurate conclusions, and additionally, the lack of a placebo. Overall, this was an interesting study. So, thank you.